new concerns about upselling and user fees at private surgical clinics. Ontario is expanding the role of those facilities in an effort to cut down on the surgical backlog. Today, one group is speaking out about potential problems. Our Queen's Park Bureau Chief Colin joins us now with more. Colin.
Alan, the Canadian healthcare system is designed to prevent patients from having to pay out of pocket for services that should be covered by the public healthcare system. But advocates say it has been happening in this province and could only happen more as the province relies on additional private delivery of public healthcare. It's a little-known fact in Ontario's healthcare system. Patients at private clinics are sometimes forced to pay out of pocket.
I had to pay $2,000 with my credit card for the MRI. Now, the charge was $2,000 for the contrast medium.
Contrast dye for medically necessary MRIs should be covered by OHIP. But advocates say private clinics offering everything from diagnostic to cataract surgeries sometimes skirt the rules.
Upselling patients in manipulative ways, attaching medically unneeded things to needed surgeries in order to bill OHIP and bill patients on top.
The concern comes as the Ford government expands the role of private surgical centres in Ontario, with new legislation that would allow for more hip and knee replacements to be performed outside of a hospital.
It will be paid through your OHIP card, not your credit card. I encourage it. We have to start thinking outside the box.
Critics are questioning whether the government is doing enough to target upselling. The government says its new law would force clinics to list their prices online and ensure that patients who only want OHIP services would still be treated. But critics argue that the current laws haven't even been able to control it.
Part of it is that patients are afraid to complain about the doctor that's going to do surgery on their eye.
So some at Queen's Park are calling for a proactive approach, a government body tasked with finding clinics that upsell.
That certainly would have the ability to conduct inspections without a patient complaint and, to have the teeth to actually hold these for-profit operators to account.
Meanwhile, as the Ontario government pushes forward, there's a new warning from the Prime Minister.
This government has clawed back or withheld money or penalized a number of provinces for not having lived up to the Canada Health Act, and we will not hesitate to do so going forward.
Funding on the line, the province could be forced to review its options. The Minister of Health says the legislation will have guardrails to prevent patients from having to pay out of pocket and to prevent clinics from charging people to jump the queue, as an example. The trouble is those regulations haven't yet been published, so a lot of the lawmakers here at Queen's Park say they're flying blind. They have no idea what is in store in Ontario. At Queen's Park, I'm Colin DeMello. Ellen, back to you.
Thanks, Colin.